Clinic. The Here With You helpline is a volunteer-run community helpline which made up of social workers, psychologists, counselors, native speakers, and migrant workers. Set up in the midst of COVID-19 circuit breaker in response to migrant workers' mental health concerns resulting from dormitory restrictions and lack of basic necessities and employment-related issues. To date, the helping line has assisted more than 1,600 workers, including workers referred from the National Care Helpline and MOH, where it played an instrumental role in alleviating the anxiety of workers in quarantine and suicide intervention. Please welcome Giovanna for this session. Thank you all the panelists for being here. To start with this session,
do you need my help? So I'm actually very excited to be here as well, especially when I know all the panelists too, and I saw Jane. Wow. She says she herself is a domestic helper and she's part of the panelists. It's so wonderful to have her in the team to understand better. So I'm excited. I'm excited to be here. Thank you for the opportunity.
Thank you. So today, let's start with Jeneline. And Jeneline, could you please share your pandemic journey, how it has affected you, and what are the initiatives that you are a part of since the pandemic started?
Because pandemic started last year. There was, I want to focus on around April because that was the circuit breaker, if I'm not wrong. So from that circuit breaker, it wasn't hard for me. It wasn't difficult for me, especially that I have an employer who really understands about the importance of mental health. So this is why I'm very grateful that all those months that it should be very detrimental, stressful for me. It wasn't really. I really didn't experience those types. Although there's a part of me who really I felt fear inside me, especially that the situation was getting worse at that time, and of course I was thinking about my family and the people I love. So that was the difficult part of me. But talking about work related issues, I'm very thankful that my employer helped me to get through that difficult time through giving me those because I want to share with you a story about that around April before the imposing of circuit breaker. You know what she did is to bought me some those gardening tools and all those seeds, because she know already that we will not be able to take our off days, and so she bought all those gardening tools that I can use to at least make myself busy and not to think about all those stressful things, stressful matters. So, but then at that time also, I found myself connecting more with my fellow domestic helpers, specifically because being one of a volunteer in a non-profit organization, which is the Uplifters, that is conducting an online education for domestic helpers, focusing on personal growth and money management. And we are catering, we are focusing on domestic helpers from different parts of the world. Like we have in Hong Kong, we also have in Dubai, we have in Singapore, and yeah. So all those things, I really heard a lot of stories, a lot of different sharings about their mental health issues, and so Uplifters and these migrant writers of Singapore also became a way for me to be connected, to be a friend, to be a sister to those who are having so much difficulties during that really challenging time last year. So up to now, and I found myself doing some good things about educating them, helping them out, and it really helps a lot also that my employer is a psychologist, and so sometimes when I have, when there are things that are really very difficult for me to explain or to understand, and I always ask for her advice on how should I advise them, how should I tell this to them that they can, how can I help them in this matter, in this thing that they are suffering. So that's really pandemic gave way for me to connect more to people, to connect more to the community, where I feel myself that I am needed, and I can do something for them.
Thanks, and your story is very inspirational, and also you can inspire a lot of migrant workers who are working here as well from all the initiatives that you are a part of. So adding to that, I would like to understand and learn from Jerome. So how you've been a part of the helping migrant workers in Singapore. So in terms of your experiences, would you like to highlight how during the pandemic and before the pandemic, how you have helped the community here? Yeah.
Before the pandemic and during the pandemic.
Yeah.
So, I think my journey really started my journey started when I was in health service. So I was volunteering there a long time ago, more than 5 years. And I think at that time, we just also at the time focused on health issues, still to focus on health issues. But at the same time also, there were workers that were owed salary. And I remember when the company closed down, almost close to 60 workers walked in, and they were seeking for food assistance. And I realized, hey, salary is actually a big issue in Singapore. Because the workers had difficulty reclaiming their salaries when the company was going bust. But it also raised to me, that the salary dispute mechanisms in Singapore are also problematic, and that there are gaps in the system that prevent people who are low wage from seeking adequate costs. Yeah, so I mean that sent me on a whole journey to find out a bit more, to go deeper, and to dig beneath the go beneath the waves. And I think anchoring me, being led by my faith to yearn for a society where we have right relationships, and where people treat each other justly, and we talk about loving and being inclusive, that it translates to very tangible things like paid salaries, like being able to access basic healthcare, being able to be transported on decent vehicles, right? Given the recent spate of accidents, even the freedom to transfer employers. And I realized that these issues came up as I go in deeper. So I've been in this scene about 5 to 6 years right now, and so during this time, I have encountered workers who haven't, had problems seeking recourse in terms of salaries, had problems seeking assistance when it came to healthcare, or seeking, adequate healthcare. And so, I was previously a caseworker at home, so I basically fought to make sure that they receive these basic services. And also were able to negotiate adequately with their employers to reach as good outcomes as possible. Yeah, so in the COVID pandemic, we knew that, especially when circuit breaker hit, we knew that this was going to be a problem, that workers wouldn't be able to come forward to seek for assistance. And we knew that this restrictions would also adversely affect their mental health. We didn't know how bad it would be and how much stress this would be on a population group that kept indoors. But we felt that a bunch of social workers and myself, we felt that we should come together and offer them the support. So during the pandemic, we received requests on the helpline. Quite a number of us, social workers, are assist trained, we call suicide intervention trained. So we provided them a helpline, and we had workers that were calling in asking for support. So we were sending things out, but also triaging for psychological risk, and also educating them, psycho-educating them on the necessary the avenues of recourse that they need.
Thanks. Thanks for highlighting your experience. Adding to the psychological help that you provided, I would like to understand from Dr. Carol on the importance of the psychosocial effort and support that you are a part of. Highlight that as well.
Sure. Psychosocial support is extremely important. You can hear from Jane, you can hear from Siobhan as well that we need, it is a form of support that you assist people to make informed decisions and help them to cope better, especially during this crisis as well, maybe disease as well, illness as well, so they can cope better to help themselves. So you're right about the psychoeducation and counseling. A lot of things that we really need to inform everybody, not only us, that everybody should know what is mental well-being about and to help themselves about it, which is really important.
Thanks for highlighting that. And in terms of highlighting the challenges that we face in mental health and in terms of dealing with it, Dr. Tien, could you highlight that? What are the challenges do we face in resolving mental health issues currently, and how do we deal with it?
So regarding mental health issues in general, I think first of all, the main gap that I often see in my experience is firstly, the personal knowledge and awareness of mental health is lacking. So a person could be experiencing a lot of distress that could be manifesting in many different ways. It could be manifesting in physical ways, in emotional ways, in behavioral ways, but the person is not aware and is not able to identify that the root cause is actually a mental health issue. Right? So that's the first gap. The second gap that I commonly see in experience is that other people around also do not know how to identify it. So the problem actually goes unnoticed for quite a long time before help is obtained. And the third common issue actually is the inability to connect the person to appropriate help. Yeah, and there are many, many reasons behind why that cannot happen. So firstly, there could be gaps in the system, that makes it difficult for the person to access the help that they need. Or secondly, it could be that the person himself who is affected is not willing to receive the help, right? Whether it's because of misconceptions or some assumptions or some stigma about mental health that they already have. Yeah, so these are the common challenges that I see.
Thank you for highlighting that. And one of the points that you mentioned is often stigma associated with mental health. So how can we build a literacy around mental health and help people talk about it as openly as we talk about physical health for them? Yeah.
Thanks for that question, and I think it's very important to actually have platforms like these to say it out loud. And I think platforms like these actually have a great outreach to the people out there, knowing that it is also being streamed online. So actually, the number of people that you can reach is actually is beyond imagination, right? Because after this, people can still access the resource and all that, and it can be a great educational resource. The other thing that I find very, very helpful is actually for people who have gone through mental health issues themselves to actually come out and talk about it quite openly, to share their own experience of what they found helpful, what they did not find helpful, and how they actually successfully processed that whole experience. And those are very helpful indeed. And actually the other thing that I find very helpful is that I understand that in many institutions of learning right now, all the students are actually being made to go through some compulsory core learning about mental health issues. So that one, they know how to identify it within themselves. Two, they know how to identify it with their friends. And three, they know how to provide emergency care to someone else who is in distress or who has a crisis. Yeah, so things like that and efforts like that, I believe, are very important in tackling stigma towards mental health issues.
Thank you for sharing that. Adding to that, which you highlighted the importance of coming up openly and sharing openly. Jennifer has been very involved in community services and being a part of the community in sharing all the initiatives in terms of poetry, in terms of writing. So generally, could you share how it has helped you and how a community, involving part of the community has helped you in your mental health journey? And if you could share examples of such as well, that would be good.
As for myself, being very active in this community, especially in Migrant Writers of Singapore and lifters, it really helped me a lot during those times that I should be thinking about all those stressful things. It has helped me a lot to discover the deeper part of my own self that because before I really don't think about all this. I really don't, these things really doesn't matter to me, especially about the mental health issue or mental health related issue. And when I get involved in this community, I came to understand that we can do something for the people around us, and not only for ourselves, but it's like we don't just live just for our own selves, but we should care also about the people around that, especially when we have knowledge about all these things. We should also be observant, and we should also be vigilant about the people around us, our friends, the person next to us. And this community has helped a lot of migrants also. Our causes, our mission in this community, especially in promoting literature among these migrants, and just simply by promoting that writing can help you to at least if you cannot say, or if you cannot say the thing that is building up inside you, you can try to write it. All those things that maybe we think it's very, very simple, but when we advise it, or when a person does it, it's really something that I myself has experienced, because all those negativities that I've been suffering, I've been about this pandemic, it's all in my poems. It's all written in my poems. So when you read those poems, it's like you are reading Janeline. You are getting to know Janeline. So this is how literature, how all these activities is helping us to cope up with mental health issues. Because just for example, with my friends, when we are talking about all these things, I can hear from them also that, especially those who are really involved in these Migrant Writers of Singapore, they are also volunteering because they themselves has discovered that this mental health issue can be resolved, or can find ways to deal with it. And of course, we are aware of what is happening around us, that there are some of us who are really get drowned into depressions because of this difficult situation. And with these small things that Migrant Writers of Singapore is doing, all the activities that we want our fellow migrants to get involved, just like Carnival of Poetry, and we also have this Facebook group, which is the Daily Life in COVID-19, formerly Daily Life in COVID-19, which was founded last April 10, 2020, and now it became an arts in me, because we know that inside of us there is really an art. In every people there is an art. So that's why we named the group Arts in Me. And on that Arts in Me, there is an interaction, there is a building up of friendship in between not only migrants but also in the local community. And that's really matters to us as migrants. Feeling the love from the locals, feeling the love from the community, that's matters. It means a lot to us.
Thanks for sharing the
Very inspiring.
aspect of expression. And Dr. Tien highlighted this, that it's important to talk about it, it's important to be open about it. But another aspect is that we have expression, we have the need to talk about. But as individuals, how do we understand or find out if somebody might be suffering from a mental health condition? If Dr. Carol can help and understand that, how we as individuals or friends and families can identify if somebody is suffering from a mental health condition.
Yeah, so I was thinking that talking about it is really very important, but sharing your concern with people who care about you, friends or relative or family members who are really concerned for you, and most of them who are really willing to listen to you and support you as well, which is really important too. Now I'm just wondering about those people who can't read, who can't draw. So I also wanted to support them, seriously. And how am I going to support them as well, where they can't even draw? So everybody have their own ways of helping themselves, perhaps drawing, perhaps not writing, or something else that we can actually work on it to help the rest that who can't do it as well. I mean, Jerome, you are nodding your head, so I guess you're agreeing to it too. So maybe Gwen, your comment on that as well.
Sorry, so can I just clarify the question?
Yeah, so we've understood that there is a need for expression, and you have previously highlighted that it's good to be open, but also highlighting that people might not be very expressive, or how can we identify and help such people who would be might be suffering from mental health condition, and as humans, how do we identify and help and support such individuals?
I think that maybe we can take a little step back away from framing this as entirely being a mental health issue, and maybe just remember that communication is something that we are all born to have and we need. So communication and connection is a need for every one of us. Yeah. So we shouldn't be reaching out to another person because of the concern that there's another mental health issue going on in another person. I think we should remember that this is just about very sincere human-to-human communication and connection, right? So I think during the pandemic, we have heard stories through our work with the migrant workers in the dormitories that workers can live in the same dorm room for 17 years and not have spoken to a word to each other. So they really don't know about the other person who's been living in the same room for the last 17 years, right? And I think I mean, there might be many reasons for that, and it would take another platform to sort of discuss what might be the reasons for those things. But if you think about that situation, can you imagine how stressful it is to keep to yourself every day, 24 hours, without connecting with somebody else, right? So actually connection and communication is so vital and so important. So actually, if we haven't heard from somebody that we know for a while, what's stopping us from just dropping a text or giving them a call and saying, hey, how are you? I haven't heard from you for a bit. What's going on with your life? Right? There's nothing wrong with that. It's maintaining the relationship, it's maintaining the friendship. And we shouldn't be thinking that, oh, you're calling me, do you think that I have a problem? You know, and we shouldn't be having thoughts like that, because we are really just doing what human beings are made for, which is connection and communication. Yeah.
Yeah, thank you. Thank you for highlighting that. And adding to this connection and communication, Mr. Jivon, you have been talking to migrant workers and also taking care of all the understanding and listening to the issues. So in terms of understanding and the common themes around what people say, what are the things that you want to highlight about the common issues that are being faced currently?
Right now,
Yeah.
workers want to get out of the dormitories, right? They're really frustrated being stuck indoors. I think they are very worried about a second lockdown. They are very stressed. I just had a phone call with a migrant yesterday, and he was like, I won't say he's one of the migrant leaders, but he was like, when can we go out again? Yeah, so that is the question I've been getting for the last 6 months. And I mean, we all are aware of the pandemic and also the risks involved. And I mean, the state has spent a lot of money also to try to avoid the numbers. We understand that, but also, but there's only so much time someone can spend either in quarantine or seeing only the same spaces, yeah. And dormitories are built for, I mean, the environment also, just the physical environment is also not one which helps someone relax. Yeah. So yeah, I mean, that just bring that up. I'm just bringing that up as one of the issues. I mean, another one is I think transform employers. That's a big issue. I mean that they feel really that it's difficult. I mean, there's difficulty coming back into the country right now, coming back to Singapore to work. But at the same time, the policy to allow workers to transfer is becoming the steps to make it a bit more restrictive than it was prior, right? So they, I think it was first liberalized to allow workers to cross sector, and then later then tightened again. So I think all these things. So what I really want to point out is that mental health is also tied to very tangible issues. Its anxiety is built because of life circumstances and the environment surrounding the person. And so so I really appreciate Dr. Grant about bringing up that, you know, it's about connecting with people. Because the connection that they have with their employers or the circumstances that have must have been quite difficult for someone to want to leave that arrangement. Yeah. I also, so this is difficult, but I think the connection that they have with others also, because they're not able to invest in social coping, in meeting people from the same village. So if you know, like on Sundays in the past, workers congregate at Little India, right? But they meet people from the same area together. So there's like Little Munchigonj, right? And Little Bapna, right? And different parts, right? And so you see people that they're familiar with and that they can share all their complaints with, even if they don't tell anyone else. But that social coping is kind of missing right now. Yeah.
Okay, thanks for connecting that. In terms also, you mentioned that the aspect of communication connection is very important. At the same time, coping, social coping has an important component. But there could be a situation where somebody might be facing a mental health issue, and he or she might want to get help early. So, just to understand how important it is to get help early if somebody knows that he or she might be facing a mental health issue, in spite of the efforts that one might need to put in. So how important it is to get an early understanding of the issue, at the same time take help on that, Doctor?
Okay. I think in any situation, I think raising it early and being able to understand it early is always helpful. Because at different stages of any kind of problem, regardless of whether it's a mental health problem, raising it early and understanding it early and talking it through early with somebody else is always helpful. Because at different stages of the problem, there will be different ways of managing the problem, right? Yeah, so for example, you could have an issue that very early on, it could just have been managed with some practical help from external sources. So other people could come in and provide practical help, and that might have resolved the issue. But if you don't resolve the issue at that early stage, and then it goes into certain consequences, then it might get a little bit more complex, where you need more than just practical help. You might need a little bit more specialized help, for example, emotional help, and all that, and systemic help, or even medical help. So I think addressing it early always has its benefits.
Thank you for sharing that. In terms of understanding and addressing this need, so in your experience, Dr. Carol, what have you come across recently that you would like to highlight, or in general, what are the cases that goes through in terms of addressing the mental health challenges?
So I was volunteering at the dorm for a month last May. So I realized a lot of things. I also volunteer with Health Serve as well. So to add on to what Joron said, the migrant workers did have communication problems and a lot of miscom and misunderstanding between the employer and them that caused anxiety as well. And not only that, the employer may not even know how to navigate the healthcare system too. They add on to the stress where they get very frustrated. And I think thanks to Health Serve that they really manage it well in a way that trying to help them navigate. For instance, one of the case that is very stressed, and he seems to have abdominal pain all the time, and he went to SGH and arranged a colonoscopy done, not done yet, appointment is maybe in June, but then in the meantime he has anxiety and he started having chest pain and he was admitted from get an ambulance and go to NUH. And NUH, so because of that, he missed the colonoscopy appointment. And he's so anxious that I need the colonoscopy appointment. So who's going to help me to do that? And he got lost along the way. Then after that, he was sent to Changi for another quarantine, 14 days. Then the doctor over there saying, not Changi, somewhere else, I couldn't remember, or saying something that, oh, you will need to get a referral from the polyclinic again to get the colonoscopy appointment. So the frustration of going around the whole system frustrated him, and he's young and he started tearing and get anxious about it. And he was saying that his employer is not helping him at all. So this kind of things like Health Serve really help navigate and help him really come straight to arrange the appointment, and rather than going around the whole system and get the subsidized again. And he's really confused. So this is a communication and connection that we really need to step up to really help them. And this is really a big gap that I feel that we can do more to help them when they can communicate.
Yeah, thanks, Carol, for raising that, because during the pandemic, what that experience has actually taught us that physical health and infection control had become so important and so vital at that time that a lot of times the mental health needs were actually neglected and overlooked. Yeah, so a lot of people took a very medical approach to people who were presenting with these unexplained physical symptoms, and overlooked the fact that it could have been contributed by actually emotional or psychological distress, and that kind of took those needs kind of took a back seat for a while. So actually, this is the hope that, in coming back better and building better after the pandemic, is that the hope is that mental health needs will take the same importance as physical needs as well as infection control needs.
Okay. Thanks for highlighting that. And one of the things that I see more and more, that mental health is getting more and more importance, and along all the spheres we are discussing about it. That is a very important fact. But in terms of how the future help or initiatives, in terms of how, not adding to talking about it, what are the different initiatives or directions that we need to take in terms of addressing the mental health challenges in the near future, or what we are going to experience from here? Adding to what we already have, how do you think that the gap can be filled by various initiatives, and what would that be?
I think that I'm aware of several initiatives that are underway, and they are all important. I think so. First of all, the very big gap that needed to be addressed was actually the level of mental health literacy among the migrant worker population. So we found that Health Serve found that there was a great need for that. So currently there are initiatives to actually do outreach education sessions to help migrant workers understand what mental health is all about, and to have the relevant vocabulary to sort of describe their inner experiences and what they're going through. Because the experience that we actually had as practitioners in the hospital is that even with translators, even with native language translators, we found that very often migrant workers in their native language may not have the relevant vocabulary to explain their psychological distress. And that was one cultural barrier that we had to overcome. So building up mental health literacy in the migrant worker population is one very big gap, and is a work in progress. And number two, actually, it is to build up a core, or rather having migrant workers themselves know that they can potentially play a role to be a mental health ambassador themselves. So they can be kind of like our colloquially termed Indian chiefs, right? The leaders in the pack that can sort of continue to promote mental wellness among their social circles, right? So they can keep the conversation going. They can also help to identify. They can also help to, look out or encourage each other to look out for each other, right? And to make sure that the connection continues, right? And also to, bring it up when they suspect that maybe there's a mental health issue going on. That's two. And I think three, there are several systemic challenges that will probably need more time in order for all stakeholders to come together and to agree to work on overcoming those systemic barriers in the healthcare system, for example. Yeah. So that's going to be a continued conversation.
Thank you for highlighting that. Adding to that,
Yeah, I also think that we should have psychological first aid awareness, mental health awareness, not only one day, but it should be also to the community, to everybody as well, who can really assist everybody, not only the migrant workers, it's everybody in the community as well that help each other.
That's a very important point. So this aspect is not just for migrant workers, but every person has some mental challenges or some mental health issue at some point of their life. They experience it not just openly that they share, but yeah, every person somehow experiences. So in terms of highlighting the community and cultural aspect of resolving mental health, generally, do you want to share about how some of the examples that you have, you are a part of, or initiatives that you are a part of in terms of helping people understand and bonding over community and connecting over different initiatives? So could you highlight your experience there in terms of community participations, and not just migrant workers? I see that migrant riders of support have got good support from locals, residents as well. So can you touch upon those areas as well, like synergy between migrant population and local through art and connections through social initiatives? Yeah.
All right. So one activity that we are doing in Migrant Riders of Singapore, which we are inviting also different people from different countries, specifically is the Carnival of Poetry, wherein we invite different poets internationally from the local poets, and then from the migrant community. And through this, we come to understand the diversity, although it's like breaking the border or connecting people through arts, through this poetry event that we are doing. And from that, we come to understand, may not be perfectly understand how does a person, the background, the country that they came from, but at least on that part, we are able to have a sharing, and we come to understand about their different cultures, and we will have idea on how to deal with them, how to deal with different peoples and yeah, this Carnival of Poetry, although it's a diverse, it's from different cultures, but its aim is to connect people, to connect poets, to give inspiration to the viewers, to the community. And one more thing is that we have this Facebook page that This Arts in Me. And it doesn't, just because it's all about arts doesn't mean that we are just focusing about our talents and everything, but then this Facebook group has become a way for us to connect with each other. And through this Facebook group also, I was able to find new friends, and I just want to share something about, I think a month ago, when I think almost all of them are going through something. And I'm a little bit overwhelmed because how can I, because all of them come to me and share all those things, and of course I need to strengthen myself, I need to normalize myself to at least support them, give something, to share something with them that can lighten up those feelings that they are feeling, that they are dealing with. So hearing all those stories, and I feel like I also joke with them that time that, oh my gosh, how come that it's like almost everyone is going through something, and it's not something that is just something, but it's a big thing that really involves their mental health. And from that, I also very thankful that I came to know Migrant Writers of Singapore, and through this I was able to know some just like you, psychologists that I can refer them to. I'm very confident to tell them that since I have a limited knowledge about this thing, because of course I can be a friend to them, but the knowledge, I don't have that much. I didn't study all those kinds of those psychological and I have a limited knowledge, and so I always tell them that just like this, it doesn't mean that I am telling you that you have a problem about this thing, but why not we connect with this with doctor like this, and so that you can understand better what is going through, what is building up inside you. So Migrant Writers of Singapore, because of the supporting people also who are supporting Migrant Writers of Singapore, we are more confident that we have someone who can help us to at least to bring these people, bring these friends we can refer these friends to these professionals. So I am very, very happy, and at that time, one friend really go through the point of being so, to the point of wanting to do something bad about herself, and it's really like as for you who is listening to this kind of what is that, to this kind of those emotions, it's really very hard. And I'm very thankful at that time that I know a doctor, through this community, I was able to refer her to that doctor, and yeah, she was able to speak with that doctor, and I'm really thankful that we have this kind of community that is giving support to us. So through Migrant Writers of Singapore, through all the locals, our friends who are supporting, we are doing so much things about this, about helping out. Yeah.
Thank you for sharing that. In fact, when I joined Migrant Writers of Singapore, I was at the poetry session, and I could see the connection, the emotion, and the raw emotion that was being shared, and it was heartwarming. At the same time, I could relate to it, because those were the expressions and feelings that the most important part that is there is a support, that somebody is listening to you, and that's the point that was highlighted, that you need to share, you need to connect, and that's the building block of having a good and a strong mental health.